Good evening, everybody, and welcome to the Port Royal January Council meeting. Hope everybody had a good new year and is welcoming in the new year. We're going to go ahead and get started. And our first item is a presentation on a COVID vaccine information. Chief?
Thank you, Mr. Mayor. I'm pleased to have Dr. Luke Baxley from the Beaufort Memorial Emergency Medicine Department and our department medical control physician join us tonight. He's going to give you a PowerPoint presentation and talk through that on the nuts and bolts of the vaccine. And at the end, he is wide open to take your questions and have a discussion at your pleasure. Thanks, Dr. Baxley.
All right, thank you, Reese. So let me share this and we'll go ahead and get started. So just an introduction. One second. I'm Dr. Luke Baxley. I'm a board certified emergency medicine physician. I've been practicing emergency medicine at Beaufort Memorial for about 10 years. And I'm here tonight to discuss the vaccine. But I wanted to do this because I wanted people in the community to have someone that they know and someone hopefully that they trust and someone who works at the community hospital sit down and give you the truth about this vaccine and hopefully put people's fears to rest and help us as a community move forward and get vaccinated. So with that, I'll get started. Please help me out here. Sorry, guys. So, a little new with this, apologize. First, I want to go over some key terms and bring everybody up to speed as far as the knowledge base goes and what you need to know to understand this vaccine. SARS-CoV-2 is the name of the actual virus that causes the clinical disease of COVID-19. The virus is pictured over on your right. It's really a tiny, too small to see with even a microscope, particle that it contains RNA, which is just a little bit of genetic code wrapped in a protein, and it has little spike proteins on the outside of it. When you get COVID-19 or when you contract SARS-CoV-2, your immune system recognizes it and you start to develop antibodies to it. Now, antibodies are just that, little proteins specific to the virus itself. And this is important when we talk about what the vaccine will do as opposed to what getting COVID will do in terms of an immune response. Antibodies from getting sick. So let's say you contract COVID-19, you get ill, you have a 2 to 3 week course where you feel terrible and then you get better. The immune response that you get from that, the circulating antibodies last about 3 to 6 months, which is not long at all and makes you susceptible to get this again. The immune response or the amount of antibodies that you get from getting vaccinated are about 20 times more than you would have if you got sick from it. We don't know how long those antibodies will last, but you can kind of confer or infer that if you have 20 times the amount of circulating antibodies, that your immunity is going to last for much longer than 3 to 6 months. We're estimating a year, 3 years, maybe, this may be like a flu shot that you get every year. This may be like a tetanus shot that you get once every 5 to 10 years. Time will tell. We will know the answer to that question when we've got data from those time periods to prove it. What is a vaccine? In general, a vaccine is kind of like a cheat sheet, like a message to your immune system that tells it how to make antibodies to a certain disease without you having to actually get that disease and suffer through in order to now have immunity. Vaccines have been around for a long, long time, and I want to talk about some of the ones that we have now. or actually some of the ones that we've used in the past. This little girl on your left suffers from poliomyelitis, and that's a disease caused by the polio virus, which affects the brain and central nervous system, and it causes just debilitating, lifelong, really deformities. This is a disease that I have never seen, I've never diagnosed, I've never treated. And the reason being is because someone made a vaccine and everybody got it. And now it's gone. Over to the two pictures on your right is a particularly nasty disease called smallpox that we had a while ago. These are scars from someone who has had smallpox. These are lifelong. This disease killed about a third of the people that got it, and the ones that were fortunate enough to survive it were blind and left with these visible debilitating scars. Again, I've never seen this disease, never come in contact with it, never had to treat it. And it's because someone made a vaccine and everyone took it, and now it's gone. This actually, smallpox has been eradicated and is no longer a threat. Please excuse the gruesome pictures, but this really drives home some of the things that we have seen in the past and no longer see. On your left is a disease called meningococcemia, which is from a bacteria called Neisseria meningitidis, and it causes, in just basic terms, it causes necrosis of capillaries. It causes skin to break down to become necrotic. Super debilitating, has a huge high mortality rate, predominantly affects kids. It's just nasty. And it's a disease that I have not seen, have not treated. And the reason is we've got a vaccine and everyone took it. On the right is the brain of a child, autopsied. You can see that this is just covered in pus. This is from Haemophilus influenza, a disease that used to kill many children, and it causes something called meningitis, and that's what's pictured there. Again, never seen it, never had to treat it, never lost any patients or children to it, and it's because someone made a vaccine and everybody took it. Again, this is meningococcemia. You can see on the left the necrosis involving the arms and legs, and this little girl was fortunate enough to survive it and live the rest of her life with those deformities. Again, don't see it, haven't seen it, won't see it because of a vaccine. I want to talk about some of the types of vaccines. The ones that we use today kind of vary in the way they work and the way they're designed. There's a live attenuated vaccine, which is the MMR, and the chickenpox nasal vaccine, and those actually contain live virus. So the chickenpox virus and the measles virus are live but attenuated, which means that they're just kind of weakened. There's inactivated, which is a actual virus that's been killed, which is the Hep A and the flu shot and pertussis. And these are vaccines that we routinely use. There's protein subunit vaccines, which they take the actual virus, chop it up, and then inject it as a vaccine, and that elicits an immune response. There's viral vector vaccines, which are fairly new, but a cool concept. They take a virus, scoop the guts out, put whatever they want to vaccinate inside of the virus, and use that virus as a delivery system to deliver the vaccine. Pretty neat. They're using it in cancer treatments to target cancer cells. And next, that brings us to the nucleic acid vaccines, which are the COVID vaccines that we have at the hospital now and are administering within the community. And those vaccines are basically a little fat globule, a lipid subunit, a lipid nanoparticle, just a piece of fat that they stuck a message in. And they're using that as a vaccine, and it is incredibly effective and incredibly safe. So the mRNA vaccines that are available now and the ones that you probably will get a chance, or the ones that will be put in front of you shortly, are the Pfizer and Moderna vaccines. Both are almost identical. Both use fat globules with a little piece of mRNA inside. The cool thing is that as opposed to the viruses that or the vaccines that we talked about earlier, these do not contain any virus whatsoever. It's not a live virus. It's not a killed virus. It's not a virus that they chopped up. It contains no virus. What it does contain is mRNA, and M stands for messenger. And that's exactly what it is. It's a little message that's delivered through the vaccine to your immune system. And it's a cheat sheet that teaches your immune system how to make antibodies for COVID-19. It doesn't contain COVID-19. It doesn't contain any part of the viral genome. And what that does is once it's introduced, your body recognizes it, and it is a map of how to make one antibody against COVID-19. It doesn't change your DNA. This messenger RNA gets incorporated into the cell, stays about 72 hours, and then dissolves, and it's gone. The vaccine itself, a lot of people have liked this slide because it kind of brings it down to basics. And this is the package insert of the vaccine. So these are all of the contents that are included in the vaccine, and we'll talk about them. mRNA, which is what we just talked about. The lipid nanoparticle that they use is made of lipids, which is cholesterol, which is present in all of us. There's monobasic potassium phosphate, which is found in Gatorade. There's a couple of other ones that are found in day-to-day items, like there's one that helps cream of wheat cook faster. There's one that helps Jell-O hold together. And then there's several other salts that we find in normal saline we give the patients all day long, every day. And the last is sugar. It's basically just sucrose. And that's it. That's all that's in the vaccine. There's no aluminum, there's no poison, there's no fetal tissue, there's no baby lung cells, there's no microchips. You're looking at what's in it. Let's talk about safety. So are they safe? Are they effective? And why should we trust them? Are they safe? Absolutely. And I can say that because I know the process that they have to go through in order to get vetted and get the EUA, which is something that allows them to come out early, allows them to be delivered to the community early. The process that they have to go through is rigorous, and it's the same for all the other vaccines that are already available today. So the FDA requires that they have at least 3,000 patients and at least 8 weeks of data. The studies that backed these two vaccines combined had about 73,000 patients and months worth of data to support its safety. These are the two vaccines side by side. You can see that they're incredibly effective. So first, is it safe? Absolutely. Is it going to work when I get it? And this is proof like I've never seen before. The flu shot that we get is like 30 to 60% effective, and everyone takes that, and everyone hopes that they don't get the flu, and if they do, it's a mild case. This is 95% effective. You're virtually immune to COVID after you get this vaccine. So why should we trust the COVID-19 vaccine? This goes back to safety and what we talked about. The emergency use authorization that is required in order to get this vaccine to the public doesn't skip any steps. So they have to go through the same steps to prove that it's safe before they can move forward. Once that data is collected, it's submitted to some advisory committees, and one committee advises the FDA, one committee advises the CDC. And the people who sit on these committees are not government officials. They're not congressmen. They're not senators. They are scientists. They're PhDs and MDs. There's the head of pediatric infectious disease at Stanford. There's many researchers from Ivy League institutions that have dedicated their life to studying vaccines and viruses. And these are the people that I want to tell me if something's safe. And they absolutely say it is totally safe and give it 2 thumbs up and have pushed it forward. Another question that I got was how did they get it so quickly? How did they get it to the front lines and get it to us so quickly? COVID started earlier this year, and it seems like already, you know, within the span of 9 months, we've got a vaccine, and that breeds some distrust in people. So I wanted to touch on that. One of the ways that, and there's several ways that they did it. One of the most important ways is that they funded the hell out of it. Everyone dumped everything they've got into it. There's virtually limitless funds to push this forward. They had volunteers that volunteered for the study. They didn't have to go out, beat on doors, ask people for volunteers. And the other thing is this was a global effort. And we already touched on the emergency use authorization, which is once they prove it's safe, that's what they use to get it to us quickly, to bypass all the other stuff that standard vaccines have to go through. So once you get the vaccine, how long are you going to be protected? So most of the vaccines, all the vaccines that we're going to get initially are 2 doses. One is 3 weeks and one is 4 weeks apart. Once you get the first dose, about 2 weeks later, people are saying that it's 50% to 60, sometimes 70% effective 2 weeks after the first dose. 7 to 14 days after the second dose is when you reach your 95% effective. We'll know more, and time will tell. And we talked about, you know, this might be a yearly thing. This might be every 3 years or every 5 years. This is a good question is, will I still need to wear a mask? And the answer is yes. Once you get vaccinated, you'll still have to wear a mask. And the reason is that until we reach that 75% and get herd immunity, the virus can still jump around our community. So to mitigate that, everyone still needs to wear a mask. What should I expect when I get the vaccine? So this will elicit an immune response, which means that you'll have some, you know, you might feel a little under the weather. You might have a slight headache. You might get a little low grade temp, want to sit on the couch all day, not really do anything, have a little less energy. And it lasts for a day and it goes away. What that means is your body has recognized that and mounted an immune response and started producing antibodies. And those antibodies are specifically against COVID-19. So the fact that you might not feel good for a day and like, my arm hurts a little bit, that's a good thing. That's what we want and that's what we expect. The second shot, you got to get the second shot in order to get up to 95%. And what they're recommending is that if you get one shot, so if you get the Pfizer shot, you probably ought to get the Pfizer shot the second round. If you get the Moderna the second round. Just theoretically, probably could switch and jump ship one way or the other, but until we know, they're recommending that you stick with the same company. Here's some special circumstances, like is it safe to get the COVID-19 vaccine if I've already had COVID? And the answer is a resounding yes. And the reason being is because if you remember what we talked about earlier, if you get sick with COVID, no matter how sick you get, the antibodies are going to last about 3 to 6 months, and then you're susceptible to it again. So you can theoretically get it twice or more, depending. If you get the vaccine, your antibody response is about 20 times as much. And so, you know, you're gonna have lasting protection way longer than you would if you got sick with COVID. If you went to Kroger and got your antibodies checked and you're antibody positive, that means that at some point you were exposed to COVID-19 and you developed antibodies to it. Still, somewhat of a blunted immune response, still recommend wholeheartedly that you get the vaccine. benefits of vaccination, and this is really near and dear to me because this has been my life for the last year. This has been a large majority of the people I've treated. I have taken care of hundreds and hundreds of COVID positive patients and seen what it does to people and seen how sick they get and how miserable they are and honestly how long it lasts, which is just astounding. There is no other disease like this, and it is just nasty. The benefit of vaccination is you don't have to go through that. You don't have to get sick in order to become immune to it. You can just take this little cheat sheet, give it to your immune system, and produce antibodies that will keep you from getting sick. The other thing that I wanted to talk about was several aspects of actually getting COVID. It does hurt young people. I see this every day. I worked a shift today in the ER where I saw probably 12 COVID positive patients, most of which could go home, most of which are not going to die from this, most of which, will do just fine. But they are super sick. They're short of breath when they walk to the refrigerator. They've got bilateral pneumonia. They're weak. They're fatigued. Saw a guy 6 weeks ago, young, healthy, takes no medications, came in and said, "Doc, I can't breathe." He's speaking in 2 to 3 word sentences. Like everything hurts. My hair hurts. My teeth hurt. My eyes hurt. And we ran the test. He had COVID, and I sent him home. And the only thing I had to send him home with were vitamins. That's it. There's no medicine for this. There's nothing even to help the symptoms. I told him to take D3, vitamin C, and a multivitamin and drink plenty of fluid because I didn't have anything else to help him with. I saw that same guy 6 weeks later, came back in and said, "I can't do this anymore. It's killing me. I still have fevers. I still get short of breath. I still have no energy to do anything. I've lost 20 pounds. You got to help me." And ran a bunch of tests. He was in the same position he was in 6 weeks ago. Still didn't need to be admitted to the hospital. Still could go home, but just looked horrible, just horrible. And he's one of those long haulers, those the 25% of the people who get COVID who have symptoms for months and months and never feel good. And if you get the vaccine, you can skip all that. We talked about the adverse effects of healthy people. So people that are super fit, super healthy, still get hurt from this virus. And they did a study looking at collegiate athletes. They get routinely screened for COVID so they can participate in college sports. And so they had a large number of college athletes that tested positive for COVID, most of which had no symptoms whatsoever, most of which felt fine. They took all of these guys and ran them through a cardiac MRI, and about a quarter of them had myocarditis, which is inflammation and infection of the heart itself. A large portion of these people went on to develop some degree of congestive heart failure, exercise intolerance, and had to withdraw from collegiate sports altogether. So it is dangerous for young people. It does hurt young people. It might not kill young people. It might not put them in the hospital, but there are ill effects that last and last and last. The other benefits are obvious. You protect yourself and your family. You protect the people that you take care of. You help stop the spread in the community. And more importantly, you set the example for those that look up to you. For you guys with medical training, you may be the only person that people know with any type of medical training. You're also leaders in the community, and people look at you for direction and look at you to basically tell them what to do. And you have a crazy opportunity to lead by example, to step up and to get this incredibly safe and incredibly effective vaccine and stop this spread within the community. The only other thing that I really would say would be that there is this is the only way to bring this to an end. This is the only way to stop this. We can't stand back and let it run its course. It would kill way too many people. The vaccine is the only way to stop this. And unless everyone participates, this is going to be a disaster. And I'm going to be sitting here this time next year, giving the same lecture, only there's going to be a lot of people that you know, that you care for, that will be dead and have died of COVID. Lastly, there is a ton of misinformation out there. There is a lot of so-called subject matter experts that feel that they have a platform and that they have credentials to tell people what's what. Most of this information is just not true. I'd say almost all of this information is just not true. Know where you get your sources, know where you get your information. Here's some links to places that contain peer-reviewed, vetted, good, factual information from physicians and scientists. And if you have questions, I would say start there. At this point, I'd like to open it up to questions, and this is really the gist of all of it. I want everyone to be able to ask whatever questions they have, and see if I can help put some fears to rest. So I'll open up the floor to questions.
Council members have any questions for Dr. Baxley?
I just was wondering, Dr. Baxley, when you think that we're going to have this available to the public?
I'd say spring, probably towards the spring. And honestly, I don't know for sure. I know it's being pushed to the front of everything. We've already vaccinated a good bit of the hospital staff. We've already vaccinated a lot of the nursing home staffs. We're moving to people age 65 and older. All the healthcare providers have gotten vaccinated and are waiting on their second vaccine. So it's just a matter of time before we roll it out to the community. I say we, I mean, I have no control over it, but
Yeah.
I would hopefully.
No. Okay. Well, I appreciate that. I've already had my first. I'm
There you
waiting
go.
on my second in another week.
Excellent.
And Dr. Baxley, it's my understanding it's not a lack of vaccines available. It's just systematically the way they want to roll this out. We have enough people to give the vaccine. We have the vaccine. They're just doing it in a systematic. It's because I'm hearing some people, again, that this information think there's just not enough people to give it, or we don't have it. We do have it. They're just rolling it out in a systematic way.
Exactly right.
Okay. Just wanted to confirm that. So the hospital is not lacking in vaccine. People just need, the people that are eligible just need to sign up and get on the schedule.
Absolutely. We have enough vaccine. Right now, we're getting shipments in routinely from what I hear. It's not a lack of substrate. It's not a lack of infrastructure to administer it. It's just this phase, this process of different phases where we want to vaccinate the frontline workers first, then the most at-risk individuals, and then the rest of the community.
Very good. Other council members' questions?
I was going to ask Dr. Baxley first. Thanks for that. That was very informative and very. I don't have no history in medicine at all, so that was very easily understandable. So I appreciate that. Is there who can administer the vaccine? Is it only the hospitals? Is there tiers to medical providers that will have it, or is it only hospitals? How's that come out?
So anyone who is licensed to administer an intramuscular injection can give the vaccine. There's some training that goes along with it. It doesn't take long, and so pretty much anyone can get trained up on how to give it. A lot of the training is just basically technique, but I'm not aware of any strenuous credentials that you got to have in order to be able to give a vaccine.
So at some point it could be people's primary care provider, family doctor.
Absolutely.
Okay.
Kevin, my wife had told me today that CVS now has a sign that they will be getting it in the future.
Oh,
So
wow.
it'll be like you can get the flu shot at CVS or any of the other ones. They're again like April, springtime frame, but that's when it's available to the public. It'll be there. Dr. I heard one other thing that came up that one of the restrictions is if you've had any other vaccine in the last 2 weeks, you can't get this vaccine. Is that something that you're aware of? Is that
So-
something people should know if they're coming up? They should hold off and do this one first?
Yeah, and I've heard that too, and I can't, I think it's a lack of knowledge and a lack of, not a lack of knowledge, but a lack of data that's out there. And so, it's a brand new vaccine. We haven't had a chance to study it. So it's safer to just give it in isolation is what I'm guessing. But they've done studies at looking at how many antigens, which are the component of a vaccine that elicits a response. They're looked at how many antigens theoretically the immune system could handle at once.
Okay.
Meaning, like, how many vaccines could you theoretically get at once? And the answer is over 100,000. And that's how complex our immune system is. It can tolerate multiple vaccinations at the same time. I mean, look at the little babies that we give 5 shots at a time. I mean, my guess is that this is going to go away in the future, and you get the COVID vaccine whenever you can get it.
Very good.
So
Any
While
other-
anybody else thinks of another question, I'm going to go ahead and share this screen real quick and then take it down. But this is the most current up-to-date information on DHEC's website about when the vaccine is going to be available. And we note here that there's a providers list in the white box, and there's some commercial pharmacies involved in that. Those will be providing it, but they will be still providing it to those people that are eligible under the phased program. And when we get into that first blue solid line, we see we're still currently in phase 1A, but there is discussion to beginning to end that and move to phase 1B, maybe a little bit quicker than late winter. And I know that the political arms in Columbia are working on that very hard.
Very good. Thank you for that.
And I guess just one more question, Dr. Baxter, just to understand it. So when you get the vaccine and it builds basically, like you said, it gives your body a message to build hundreds, whatever the number was of antibodies. At that point, if you come in contact with COVID, do you still get infected with COVID? Does it just kill the disease, or does it just make your body to where you don't get sick from COVID?
That's an excellent question and a tough concept. When you get the vaccine, you start to make antibodies shortly thereafter. The antibodies neutralize COVID virus. And so the more antibodies you have, the quicker that virus will be neutralized. So you can kind of imagine that, as you progress through the stage of after the first shot, then get the second shot, if during that period of time you come in contact with COVID, if you get sick, it will probably be much milder. Once you've reached full immunity, that 95% immunity, what happens is, let's say you're out at a restaurant, someone sneezes, you get a big dose of COVID. What you've got already are circulating antibodies that just eat it up, and it never takes hold, it never starts replicating, and therefore you never get sick.
So at that point, and using that example, would you be able to transmit COVID yourself at that point if your body has neutralized it? Are you still able to, if you sneeze, are you still going out, or is it your body keep it in?
That's also a good question, and they don't know yet. They don't know if this vaccine is going to make you completely immune to spreading the disease. They know what it does, and the reason is because that's what they studied. They studied the efficacy instead of studying if it prevents you from getting a little bit of COVID and maybe spreading a little bit of COVID and never really getting sick from it. Those studies are coming, and so we'll know the answer to that question at some point. We just don't know right now. I can tell you from a science and a medicine base that it probably does, to a large extent, prevent you from also spreading COVID. But we don't know, so we can't say.
I guess the best case scenario is if you are sneezing on someone, they've had the vaccine. So even if you are spreading it, they neutralize it.
Yeah. It's probably not a good idea to sneeze on someone.
That's why, until we know that, that's why wearing masks is still important.
Yeah, that's the whole reason for the mask is using it. Yeah.
That's the point.
Well, Dr. Baxter, we can't thank you enough for, giving us this, and hopefully there is lots of people watching this and heard from you. And again, I know that you guys, I know the hospital and yourself are available to answer the questions that people have. And that's the key, is they need to know if they've got a question, there's a way to get it answered. We're certainly, like Kevin said, we're not trained medical. We don't, but we've learned things here, and we know where to send people for information. And that's really what's helpful and what's important to the community.
Certainly, and I am always available to answer questions. I'm really passionate about this because this has been my life, and I want this to be over. I want this to end. The only way we're going to get to do that is if everyone gets this vaccine. There are a couple of other things that I wanted to touch on just for sake, for the sake of them being out there, and that's infertility and Bell's palsy and pregnant and breastfeeding. So pregnant and breastfeeding, I've had a lot of questions. Can I get it? Should I get it? Do I need to get it? Pregnant patients and patients that are breastfeeding were excluded from the study. So we don't know, we don't have data. There's nothing in this vaccine that is teratogenic or could cause birth defects that we're aware of. mRNA certainly can't. And just from a personal note, I don't see anything that's dangerous in this vaccine. They recommend that they take it on a case-by-case basis, and they recommend that the patient speak with their physician about it. So if you're pregnant and at home and isolated from everyone else, it's your choice. If you're like some of the nurses that I work with, gowned up in PPE, 6 months pregnant, taking care of a COVID positive patient in an ICU, you should probably get it. And reason being is because COVID, the virus itself, is way more dangerous and way more likely to cause miscarriage and birth defects and you name it on our immunocompromised pregnant patients. So that's one thing that they talked about. Breastfeeding, also case by case, talk to your doctor about it. Infertility is a question that comes up and is a question that has come up every time a vaccine has been rolled out. And it's always a difficult one to answer because it's rumor. It is only rumor. There's nothing out there that's ever proven that any vaccine ever has caused infertility. And I don't know why this topic keeps coming up, but it does. What we know about COVID, the actual virus, is that it affects almost every organ system in your body. I don't see how it would exclude your reproductive system from that. There's a study out there that's being done right now looking at COVID, and it's starting to show that it affects sperm quality, and that can also lead to infertility. So I wouldn't be worried about the vaccine causing infertility. I'd be worried about COVID causing infertility. The other thing is Bell's palsy. There are some people out there that are really hung up on this vaccine causing Bell's palsy, and 7 of the participants in the studies of 73,000 got Bell's palsy during the vaccine phase at some point between 3 and 42 days after the vaccine. And the answer to that is that yes, they got Bell's palsy. Yes, they got the vaccine. They are true, and unrelated. And if you look at a certain population, so Bell's palsy is really common. It's going to happen in the community regardless. People are going to get Bell's palsy. If you look at 100,000 patients, 25 to 35 of them are going to get Bell's palsy within a year. There's 40,000 cases of Bell's palsy in the United States annually. So it would just make sense that if you took a certain bit of that population and vaccinated them, that some of them are going to get Bell's palsy because some of them are going to get Bell's palsy anyway. And if you look at the numbers, the participants in the study got Bell's palsy. They were way less likely to get Bell's palsy than the general population. So I hope that clears it up.
Mayor and Council, thank you very much for having Dr. Baxley and taking the time out tonight to educate our community.
Sure.
I have one more question.
Yes, sir.
I know we're in phase 1A and we, eventually move to 1B. Can we talk a little bit about the vaccination registration process and how that works and how people need to interact or interface with that in order to to get set up? Because I understand that we've got a certain amount of the population in that phase 1A that are vaccinated, and there's going to be some folks that do not want to take the vaccination. And there are some calls now to, all right, if you're not going to take the vaccine, let's start moving this process along. So what do those folks need to do in terms of registering, or what's the protocol?
I could talk about the science behind it. I can't really talk about the logistics and the protocol. What I know is from experience, I got the vaccine about 2 weeks ago, and I went on first I was invited. I got an email from the CDC, was identified as a frontline provider and invited to get the vaccine. I went to VAMS, VAMS, which is the Vaccine Administration something or another,
Yeah.
and logged on, created an account, answered the screening questions, and then they sent me a link to register for when I was going to get the vaccine.
Also, Dr. Baxley, you might just tell them one of the things that when we did get that email, that it is unique to you and you can't forward it to somebody else to use.
It is. This is true.
So this is a partnership with the U.S. Department of Health and Human Services and the CDC, and it's hosted at usa.gov. But folks can go to VAMS website right now, vams.cdc.gov, and get some information on how the process will go once it's time for their class in the phase to sign up. But right now, this is the control measure that makes sure that folks are in the correct phase, are getting the vaccine when they're supposed to get it. So that, Dan, that's what I would encourage people to do right now, is monitor DHEC for the advancement of the phases and monitor the vaccine website, VAMS, for when they can sign up to get it. And then it'll guide them to the correct provider where they'll be able to get it.
Because there's going to have to be some validation and vetting for the subsequent phases, because we're going to start moving into school teachers and daycare workers and other essential workers. So, there's going to have to be a process and a vetting to ensure that this is being done properly. And so that's what I want to emphasize. So going to that website is certainly a step in the right direction.
And currently it's employer-based, and in the ones that you just highlighted, I would fully expect that to continue. So the human resources departments of all those employers are doing what Dr. Baxley described for their employees.
Okay.
Thank you, everybody. Very good
Thank you,
information.
Dr. Baxley.
Thank you.
Thanks for letting me be here and for donating your time. I really appreciate it.
Thank you.
Oh, thank you for what you've shared with us, because I think it's very important to the public to understand and how important that vaccine is. And Chief, if you can you forward us or email us a copy of the timeline and all?
Yes, ma'am.
Thank you, sir.
Thank you. And lastly, Dr. Baxley, thank you for what you do at the hospital every day,
Yes.
and seeing those patients and dealing with them and helping them get through all aspects of health, not just COVID.
Yes, sir.
The emergency room
you.
is a tough place to be. I visited a few times in my life, and BMH saved my life one time there. So thank you very much for what you do.
Yes,
Well,
sir.
thank you and all your team that works with you out there.
Okay, the next item on our agenda is a presentation by Eric Greenway on the impact fees that are being proposed in Beaufort County. Eric, we'll turn it over to you and look forward.
All right. Thank you. Let me share my screen here, wherever that is. So,
If you're using a regular Windows PC, go down towards the bottom, a toolbar comes up and it's a green share the screen.
yeah, have you got it? Can you all see that?
Nope.
No?
Anybody, we're not seeing it, right? Make sure it's not just me. There we go.
All right.
Well, it came, yep, there it is. Very good.
Okay, so I can make this as long or as short as you all want it to be. After hearing that good presentation from Dr. Baxley, I'm probably going to go short. This is the full presentation for both the northern part of the county and the southern part of the county service areas. I will go through all 6 or 7 impact fees this evening, and I will cover both service areas for those impact fees. The south of the Broad service area impact fee information will just be a cursory review for you all. You will see the information. I'm happy to answer questions about it, but I will not spend a lot of time on it due to the fact that it really doesn't affect you all. So as you can see, the presentation that I'm giving you this evening was actually developed by Tischer Bice, a consulting firm who did the consulting work for the impact fee study and update. And I'm going to walk you all through that. The impact fee presentation is going to have two basic parts. The first part is going to be an overview of what an impact fee is and what they're designed to do, what they can do, what they can be used for, and the legal issues associated with those as to what we have to do in order to implement impact fees. The second part, of course, will be the details of the study, a lot of numbers, a lot of amounts and things like that for you to absorb. Once I do this presentation, I will email it to Van tomorrow so that he can send it back out to you all as city council members and people on the Zoom call here for you all to look at and ask any questions to me after the fact. So, all right. So generally impact fees from an overview, and also feel free to stop me at any time if you have any questions about this. This is complex stuff. I'm going to try to break it down just like Dr. Baxley did and make it easy to understand, but it's kind of complicated to understand initially. But once you think about an impact fee, it makes a lot of sense. And our state legislature has done a really good job of tying the name to what it's actually designed to accomplish. So an impact fee is just that. It's a one-time payment for growth-related infrastructure. And I'm going to go over the various impact fees that we charge in Beaufort County here in a moment. It is only paid by new development, not existing residences or businesses, unless those existing residents or businesses vacate an existing property and build something new. So if you live in a house and lived in that house for 20 years and you build a new house, then you would have to pay the impact fee on the new house, because presumably someone is going to be buying the old house and that may be coming in, and the new house is creating, you know, a need for additional roads, schools, services, the various things that we charge impact fees for here in the county. They fund capital improvements that add capacity. So you can't use an impact fee to pave a road or repave a road or improve a road unless that improvement is designed to add capacity. So you could, let's say, use an impact fee to fund a road improvement to add a turn lane or do an intersection improvement and possibly get away with repaving the road as a result of that capacity project. But you couldn't just charge an impact fee to say, well, our roads are substandard, we need to maintain those, so we're going to use an impact fee to do that. So it is only for capital improvements. Impact fees can also be used to purchase equipment in excess of $100,000 per. So you will hear in my presentation on EMS fees, most of that is will be spent to buy ambulances and things like that that would meet that threshold. An impact fee is not a tax. That is a misconception. It's an agreement to build infrastructure. So it helps alleviate pressure on general fund tax revenue for capital projects. So what does that actually mean? Well, if you look at the infrastructure and growth we all know and would agree, I think, causes a need for additional things to be built, improved roads, additional schools. Certain services are impacted by that on our infrastructure. Well, if you have the impact fee and you can use that money to build that infrastructure, then you don't have to hit the general fund revenue in order to spend money on that infrastructure. So you can use those dollars to do other things to deliver services and improve quality of life for the citizens in a different way. In order to have an impact fee, you must meet 3 requirements. There needs to be a need. So you have to prove that the growth is creating a need for the infrastructure that you're charging an impact fee for. And you will see here in a moment, as it relates to schools, that there is a need in one part of our county and there is not a need in another. So we could not charge an impact fee for that particular item in one area of our county. There has to be a benefit. The growth receives a benefit from the infrastructure. So in the case of road improvements, you're adding capacity to roads to handle the additional traffic that is created by the additional houses or the additional trips generated from a commercial project. So the commercial project or the housing development receives a benefit from those infrastructure improvements to keep traffic moving at a safe rate, safely along a road corridor. And then there has to be a proportionality test that has to be met. So the growth that you're paying the impact fee, you're charging the impact fee for, pays its fair share of the cost. It can't be more than its proportional share. And you'll see in a moment here on some of the charts, there'll be a credit that'll be issued for debt service. So if people tell you as a city council or as a mayor or city or town staff that, well, I pay taxes, so, you know, the impact fee is just going to make me pay twice. Well, the impact fee can't make you pay twice because we have to back all of that out of the impact fee. So in some of the charts, you will see debt service requirement credit because there's another bond or revenue source that has been set up to pay for certain portions of the impact fee items that we're going to be discussing. So any questions about that real quick?
None for me, council.
Nope.
Sounds like we're okay.
Okay, so you'll see 3 types of impact fee methods as I go through the presentation. Again, you don't really need to understand these to understand the rest of the presentation, but you're going to see them. So I thought I would explain it to you real quick. Basically, it's a past, present, future type of situation. The one in the past is called cost recovery. So basically, there's oversized or unique facilities that get built, and this method typically funds a debt service for infrastructure that you have built. And then there's the incremental expansion, which is a formula-based approach that documents a level of service, both from a quantitative and a qualitative measure. Most of our impact fees have used this method. Some of them will also use the third one called a plan-based, which is a future thing, and it's based on a future plan for infrastructure growth. So to give you an example of that right off the bat is parks and recreation. It's pretty much some of the parks that we're proposing is plan-based because the growth is going to create a need and we have a plan to meet that need. So we've calculated that based on that particular methodology here. So any questions about that? Again, you don't need to really understand that. I just highlight those because you're going to see them as I go through the presentation. So in South Carolina, there's some things you have to do with an impact fee. One, impact fee revenue must be maintained in an interest-bearing account and be segregated from the other revenues so that we can adequately track it. Monies must be spent within 3 years of the scheduled date for construction in the capital improvements program or the CIP. So what does that mean? So it doesn't mean that you have to spend all the impact fee money within 3 years of collection. But if you have a capital improvements program list and it says that you're going to widen X road in 2025, then you either have to spend that money for that widened road by 2028, or you have to start refunding it back to the people that paid it in the same order into which it was paid, first in, first out. So most people say we have to spend the impact fee money within 3 years. That's not entirely correct. If you've got something on your CIP that says that you're going to do a project in 7 years, then you have to spend the money within 10 years, or at least start the process within 10 years. So we have to publish an annual monitoring report that's for transparency purposes, to show that we have used the money for those particular projects that we've listed in each CIP for the impact fee programs that we're adopting. You have to do a comprehensive review and update every 5 years. That requires an updated study. We are a little bit behind on that, but we're working through all of that right now. And then it requires an analysis that estimates the effect of imposing updated impact fees on affordable housing in the county. So we do have to run that analysis. I will go over those slides with you here toward the end of my presentation. But let me say something about this, because this is an argument. I have in my career worked in 2 jurisdictions that are high growth areas that have had impact fees. And the argument is always, well, from the developer side is, well, if you all do that and adopt an impact fee, that's just going to stop growth and slow down growth. That is not been my experience here in South Carolina in the 2 jurisdictions that I've worked in. If anything, because of impact fees, growth has accelerated in those jurisdictions, because the improvements that are being made to the things that you're collecting the impact fees for get so much better, so much faster. It tends to draw more people into that area. Prime example of that is when I was in York County, we adopted a $2,500 impact fee for schools in the Fort Mill School District. There were 4 school districts there. Everybody in Fort Mill sits just south of Charlotte, North Carolina. Everybody that built houses in Fort Mill said, well, it's just going to shut down growth in Fort Mill. It accelerated growth in Fort Mill because the school system got that much better, that much faster. And people started moving there predominantly because of the school system. So, and $2,500 on a mortgage or an impact fee on a mortgage spread over the time frame for a mortgage is a negligible cost. So now the impact fees in York County went from $2,500, and Tisher Bice did their study a couple of years ago. And I think impact fee for a single family house there now is $17,000 per unit for schools, and $12,000 per apartment unit. So anyway, it's going.
Can I ask a question real quick about that one?
Yeah.
So how long can a time frame be put on an impact fee? How are they?
Okay, really, that's a really good question, Councilmember Phillips. So an impact fee, basically the way it works, as long as you have projects listed in your CIP have not been completed, then the impact fee can remain in effect. So essentially, once you've completed all the projects on the list, the impact fee goes away. So you have to do adequate planning to make sure that you plan the projects accordingly and keep the impact fee in place long enough to cover those projects.
So it just has to be reviewed every 5 years.
Has to be updated every 5 years.
And is there a mechanism to repeal an impact fee once it's been enacted, or does it?
Yeah, it would be the same. Impact fees are adopted and repealed in the same manner as the jurisdiction would adopt a normal ordinance. So in our particular case, it's for our county, be 3 readings and a public hearing to adopt and a repeal. So these are basically the growth numbers. I'm not going to read all of that to you because it's very busy, but you know, we all know that Beaufort County is a high growth area, and that growth, I mean, Port Royal, you all are growing, City of Beaufort is growing, Bluffton's growing, Hardyville's growing. We're in a high growth area, and that's going to continue for the next 10 years or more. And there's going to be a lot of numbers now, so I'm not going to bore you with trying to figure all of that stuff out. But you know, total housing units in the next 10 years, you know, we're expecting around 19,000 additional housing units in our county. So moving forward on that. So that's going to be a lot of additional people coming into the area. So in our particular case in Beaufort County, we do impact fees with the municipalities through intergovernmental agreements. We're in that phase with the various municipalities right now. We do have IGAs currently in place for some capital components with the municipalities, including Port Royal, but we have to revisit the IGAs with the municipalities, and we've done that with the mayor and Manager Willis recently, and we're working on responses to some of their questions and adding some projects that they have asked us to add to the impact fee list for Parks and Recreation and other things that, and we've added other projects from transportation standpoint, I believe, in our study for the town of Port Royal as well. So one of the things that you all have asked us to add that we are adding is the is improvements to the property. And I don't know the name of the park. I'm sure the mayor or Van will correct me, or all the city council members will, but the skateboard park.
Naval Heritage Park.
Yeah, Naval Heritage Park. So we've worked with the mayor and Van to develop some cost estimates on doing some improvements there that will be eligible to be covered for impact fees as we go through this. So we're reevaluating whether or not that would change the fee requirement for Parks and Rec that you're going to see here in a few moments. So any questions about the intergovernmental agreements? The intergovernmental agreement basically says that Beaufort County is going to adopt the impact fee. The towns would collect it, would send the predominant revenue to the county to use for these projects on the capital improvement list. And then you would keep a small administrative fee for doing the collection.
That's a question.
Yeah.
What's the administrative fee?
Okay. So the administrative fee typically right now is 1%, but all the other municipalities have asked for 5%. So here's the problem with that type of increase. There's two issues with that in my mind that we just need to make sure that we have some legal coverage on as we move forward. First of all, the state statute is silent on whether or not impact fees can be used to cover administrative fees for the collection by municipalities. So that's one issue. So it doesn't say that you can keep a portion of an impact fee for administrative cost of collecting the impact fee. Secondly, the impact fee, I do believe that the administrative fee, as long as it's reasonable and can be tied to a cost to serve type of thing, would be appropriate for you to do as a municipality. 5%, and it doesn't necessarily mean so much for the northern jurisdictions, the north of the Broad jurisdictions, Port Royal and City of Beaufort, as it will for south of the Broad. But 5% of an impact fee that may only cost you $100 to process, but you're keeping $800 of an administrative fee, that might be a legal issue that we would get a challenge on. So we just got to work all of that out as we go through this IGA process, if that makes sense.
Yeah. Okay. Thank you.
In the town of Bluffton and the southern part of the county, where we're talking about a school impact fee, where the school impact fee is going to be $10,000 per house, you're keeping 5% of that. I don't know that you can justify that it would cost you 5% of a $10,000 permit for each house from an administrative fee to keep that, plus all the other impact fees that they would be collecting south of the Broad. So,
But so just to be clear, that the education impact fee, that is only south of the Broad.
yeah, that's what I'm getting ready to go over right now. So this is the school impact fee, as you heard me say earlier, about one area of the county having a need for infrastructure and another not. So essentially, this is the north of the Broad school projection for growth for the school district. And as you can see, The red line is the capacity for the schools north of the Broad. The blue line is the growth for the northern Beaufort County, and the gray line is the needed capacity for northern Beaufort County. And as you can see, they are declining from the red line over the next 10 years. I'm not going to say 10 years from now that it's not going to reverse and be something different, but right now those lines are moving away from the capacity. So you're actually creating capacity in the existing schools that you have. So you can't charge an impact fee when you have that situation going on, because the growth isn't creating a need for additional infrastructure in the north of the Broad service area. So south of the Broad is a different story. Again, red line is the capacity, blue line is the south of the Broad enrollment. The gray line is the needed capacity. And as you can see, in the by 2024, they're going to be out of space and be exceeding their capacity. So they need the impact fee.
Yes. When you say that you can't enact an impact fee, is that statutorily regulated from the state, or is that
That's
just
correct.
the county policy?
It's the state statute.
That's the state statute. Okay, thank you.
Yeah.
Yeah, 'cause
I mean,
that goes back to the capacity. If you don't need the capacity, you can't increase the capacity.
that's right. Exactly right. So that means that there will be no school impact fee proposed, or is no school impact fee proposed for the north of the Broad service area. The south of the Broad service area, you can see the breakdown here in the green. Each category in the chart, elementary, middle, and high, what that would equate to as far as the impact fee for each of those K through 5, 6 through 8, and 9 through 12, to give you a total fee for single family of $9,500 per household and multifamily of $4,500 per unit. So if you have a 200 unit apartment complex come in, then that's $4,500 times 200. So that can be a big issue. So we're working through all of that right now. This is going to be the most controversial piece of the puzzle for the impact fee study and update as I see it at this point. Because again, this is the one that really is going to catch the eye of the developers and the people that would claim that this is going to slow down growth. So again, based on that, the 10-year projection for that would be that the single family and multifamily rate would bring in $89 million over that 10-year period for the school district to use to add capacity south of the Broad. So having said that, even though it applies to the south of the Broad right now for infrastructure, again, keep in mind that if this fee goes in and everyone participates, that will free up other general fund revenue from the school district to be used for things that, could improve the district wide. So even though it doesn't apply to the north of the Broad, there could be an ancillary benefit to north of the Broad as a result of this fee existing south of the Broad, if that makes sense. So going back, that's the new school is a new impact fee. We do not have a school impact fee currently. We do have a Parks and Recreation impact fee. So again, going back to those three methodologies, you can see that we have regional parks, community parks, neighborhood parks, and recreation centers. All of those are calculated on the incremental approach, which, is basically based on a level of service, both from a quantitative and a qualitative standpoint. The service areas for the regional parks is county-wide. The service areas for all other parks are broken down into north of the Broad and south of the Broad service areas. We only currently have an IGA with the town of Bluffton for recreation. So currently the town of Port Royal does not participate in the collection of the Parks and Rec impact fees. That is a discussion that we're going
Right.
through right now with them.
And then Eric, after our meeting, it is agreed that a municipality can own a regional park, right?
That's correct, yes.
We have come to that conclusion that
That's
it
correct,
does not
yes.
need to be a county owned. There are regional facilities in the
That's
municipality.
correct. And again, the distinction on an impact fee doesn't really matter about who owns it. It
Correct.
matters about whether or not the necessary infrastructure as a result of growth is in that capital improvement plan that's been adopted as a part of the impact fee ordinance.
Very good.
It's on there and we're adding capacity. It doesn't matter who owns it or who operates it. It can be eligible for those expenses.
Thank you for that clarification.
So basically, the needed growth related expenditures on this chart for the next 10 years for a regional park, which is countywide, would be $8,800,000. So that would be a regional park, which is a countywide service area. You can see here, community parks, neighborhood parks, recreation center acres, recreation center square feet. All of that's broken down here. I'll let you absorb that, but north of the broad growth related expenditures for, I just went somewhere. Let me go back. North of the broad growth related expenditures for all those other parks would be $3 million over the same 10-year period. So regional parks, that's countywide. So it's a larger pool of money because they're being provided on a countywide service area. The rest of these parks are being provided on a north of the broad and south of the broad service area. So north of the broad says that we need $3 million over the next 10 years to provide an appropriate level of service for our parks and rec. This is the south of the broad number. There it's 2 million for these other facilities. Why is it lower south of the broad and north of the broad? Because south of the broad, we've already used impact fee money to expand the Buckwalter Recreation Center. So the need's not as great there currently because we've already done that expansion with impact fees. And if you all have been to Buckwalter Rec Center, that would actually show you all what type of potential improvements can occur through the collection of impact fees. The town of Bluffton works with us on Parks and Rec, and we've been able to put in a pretty nice facility there with a lot of amenities, including an indoor batting cage in that facility through the use of impact fees. So essentially, you're going to see these charts. These charts are basically, the green is basically the maximum supportable fee per unit after doing the study. If it's black, that's an increase. If it's red, that's a decrease. On the left side is the north of the broad service area on this slide. And as I talked to you earlier about credit for debt payments, you see that $4 right there in the box right underneath the north of the broad service area. That is that credit that I talked about for the double dip. You can't make people pay twice for the same infrastructure. So essentially the fees for, a housing unit, we're doing housing units now based on square footage instead of just across the board of a house. We're doing it on square footage to try to help out with that affordable housing situation, because presumably the smaller the house, the less the need, the larger the house, the greater the need. And that's been, statistically proven by our consultants to be an accurate assessment here. So it ranges from an increase of $165 all the way up to $1,000 if you're building 4,000 square feet or more. So south of the broad.
Eric, that's an increase. That's an adder to the 321. That's not the new fee. So it's
That's
321 on the smallest house. It's 321 plus the 165.
That's correct.
Okay. Okay. So it's not the last column. It's a combination of the two columns.
That's correct. So basically the real fee, the total fee is right here in the green,
Okay.
if that makes sense. So that should be 321 plus 165 should equal 486 all the way down. So we're going to pay attention to the green. All right, so I keep switching slides here because my mouse is real trying. So any questions about this from Parks and Rec standpoint? Again, Port Royal does not participate in this yet. I think there's a real opportunity for you all to start doing so, because I think we could jointly come together and do some great things that would really improve the quality of life for residents north of the Broad, in Port Royal, and the city of Beaufort, if we started working a little more together on the collection of these impact fees for Parks and Rec. So again, over the 10-year period, the projected revenue for north of the Broad would be $4.2 million. The total expenditures would be 6.6 for regional and all those other parks. Non-impact fee funding would have to $2.5 million would have to come from another source, because there's just not a way to collect enough impact fees to cover all of the needs there. So that would have to come from general fund, grant money, other types of situations where we might be able to qualify to make up that difference. And then this is the south of the Broad. They're $3 million short on what they would be expected over the next 10 years.
Eric, before we move on to libraries, just so that we understand as we close each one of these out. So at some point, council is going to get to see an actual capital project list.
Yes.
With funding and priority on each one of the projects associated with each one of these buckets we're going to look at now.
That's correct.
Is that the way? Okay, I just want to make sure. So
We're
we'll
updating based on our meetings with all the municipalities. We're updating the project list that have been given to us. We've included the projects that Van sent to us from our meeting with you and Van, and we're going to resend that out to all the municipalities to look at one additional time before we continue on with this.
Very good. Thank you.
We'll get to see all that before we move forward, making sure we've covered everything.
Thank you.
Now it'll probably be all the items. I mean, we're not going to send you the Parks and Rec and then the libraries and all that. So all the projects will probably be on there
That's fine.
in one spreadsheet.
Very good.
So now we'll move on to libraries. Again, you can see it's the incremental based on the quantitative and qualitative levels of service. The service areas here are again north of the Broad, south of the Broad. Bookmobiles, since they're transient, have been done on a countywide service area. We currently have an IGA in place of Bluffton, Hilton Head Island are participating. Beaufort and Port Royal are considering participating, and we've had discussions again with the mayor and the town manager regarding Port Royal's participation in collecting those fees. And again, here's the thing about this is, we probably need to look at, at least some higher level of service within the town, bookmobile or using a facility or a building that we may have in the town to put in a small library to offer some, online programming or various programming like that. I'm not saying what that would actually look like, but we're having that discussion with you all as we move through all of this. So again, the north of the Broad growth related expenditures over the next 10 years is a little over $3.5 million that we need in order to do it. South of the Broad is 3.2 million. So it's 6.5 million total. And then for the bookmobiles, which is countywide, the growth related expenditures for that would be $60,000 over the next 10 years. So we don't really expect a lot to do with the bookmobiles, but again, we can use those. They're a great service to come through. And then again, you can see the fees in green in the middle that are the total fees. And then as you track across, you see a lot of red in that last column on both north of the Broad and south of the Broad. So essentially there's going to be a decrease in the impact fee across the board for libraries based on the various sizes of those houses until you get up to the 3,500 square foot house. And then that would be one of those things where it starts increasing a little bit. So any questions about that? All right.
Good.
So basically that would generate $3.5 million. Our total revenue would be 3.5 million. Our total expenditure would be 3.6. That leaves us about $102,000 short. That is where you want to be whenever you're doing an impact fee program. You want the revenues and the expenditures to kind of line up so that you're not too short and you don't need to make up that shortfall from another source that may be taxed or may be, when I say tax, I'm not talking about taxes. I'm talking about, maybe hard to get from another account. So, and then this is south of the Broad. Again, the number there is 0. So libraries, we're in pretty good shape on if we can get all the municipalities to participate in that with us. EMS is a new fee. And we've had some discussions again with the town about this. So 2 types of things. EMS stations is a capital improvement that you can make, and EMS vehicles, because they cost more than $100,000, are eligible under the state statute for you to be able to purchase ambulances and things like that. So again, the service area is countywide. We do not do anything on Hilton Head Island because they have their own EMS service. There are no current IGAs because this is a totally new fee, just like for the schools. So we're having to go through all of that negotiation with each municipality. So growth related expenditures for EMS station over the next 10 years, $4 million. Growth related expenditures for EMS vehicles, $1.5 million over the next 10 years. So basically the fee looks like this. Again, you can see the credit there in red for the debt payments that we currently have in place. And this is what the numbers shake out for the individual houses. And again, I don't want you all to try to keep track of all this. I'm going to show you a chart here in a little bit that's got all of these fees lined up so that you can see what the impact will be totally. So any questions about that? So again, one of the questions we have from another jurisdiction is, okay, well, let's say we do an EMS impact fee. Do people still get charged if the ambulance has to come out there and respond to them? Yes, because the impact fee is done for capital purchases that are necessary as a result of the growth. The EMS charge is based on the delivery of a service to service that individual that calls EMS. So there would still be an EMS charge in addition to the impact fee, if that makes sense. So you're still going to get charged if the ambulance responds to your house, because the ambulance, that charge goes to pay for personnel and the cost of operating the system, not for the capital infrastructure that's necessary that has to be purchased as a result of the growth. So again, projected revenue, 4 million, total expenditures, 5.5, leaves us short about 1.4 million over 10 years. So again, this is a new fee. No one has a thing on that. I can go through the fire if you want me to, but again, you all have your own fire impact fee, I believe. I don't think I need to go through that. So I'll go through those slides real quick here. I'm happy to answer any questions about this. I'll send that to you on the in the email tomorrow. If you all have any questions about it, I'm happy to do it, because there's some unique things about this that our fire chiefs have done to say that, they would forego the fire impact fee if people agreed to put in sprinklers in their house. So that's something we're going to be doing to help people save money on the impact fee if they put in residential sprinklers. So transportation, this is the one that's always the largest item, the one that's most talked about. You guys are probably glad I'm there now and through all the other things. Transportation improvements is done based on a plan-based approach. Again, you have a plan, capital improvement plan for future growth needs as well, future growth needs. And the service areas are 2, north of the Broad, south of the Broad. All municipalities participate in the collection of transportation impact fee. So these are the projects north of the Broad. So I'm gonna pause here and let you all look at these to make sure. And we're updating this list. So there may be things not on here that you all, may ask about. We're gonna send you the updated list, but I do want the town council to look at those projects real quick to see if anything catches your eye about anything that we may need to add.
Where are the 9 traffic signals?
That would be determined through signalization studies.
Okay, so that there already hasn't been a determination. That's just what you believe would be there. Okay.
That's what we have put money in. We believe that that's a very fair estimate for future signalization. Right now in the current impact fee, we don't use impact fee money to do signalization. And that's always problematic for high traffic developments because the developers say, well, I don't have the money to put the signal in. So we're going to have that money so that it can be used to help out with that.
The last project on the list, the Port Royal interconnectivity, is that the Reboat Road parallel to the trail?
I'm gonna ask the city manager to respond to that, Van, if you know that. I think you're right, Mayor, but Van submitted that project, I believe.
Well, yeah, that was what, as I'm looking through the list, I know that one of the other projects that we were contemplating was the connection of Broad River via Midtown out to Paris Island Gateway. And so that's one of the reasons why I was questioning what the Port Royal Road interconnectivity would be. Because I know that we've talked about the potential of connecting Battery Creek to Bero Road running parallel to that rail corridor. So just probably need to clarify, because I'm trying to recall if I've ever seen it described as Port Royal Road interconnectivity. I thought there was, when we were talking about the Midtown connection, there was something more specific.
Yeah, it couldn't be much because it couldn't be much of a project because it's only $950,000.
Yeah, that's my concern, Van. That number doesn't match either one of the projects that we've been talking about. And both of them should be named something different, because the reason we're looking to do the interconnectivity on Reboat Road down the trail is because 90% of the traffic that uses Lenore and Drayton go into the city of Beaufort. So it really should be City of Beaufort, Port Royal interconnectivity. And
I can tell you that we've added all the roads that all the projects that we talked about, including the improvements to Spanish Moss Trail. To get across Rebo to the updated project list. So that'll be the actual list that I send out to you all tomorrow.
Okay.
So look at that. And if we need to reword anything and get more detailed down in the weeds, again, this is the list from back in November 2019. So we're a long way from that.
And well, if that's the case, then that Port Royal Road interconnectivity is describing that Broad River to Midtown, to parallel Paris Island Gateway connection.
Right. That makes sense. And that really needs to be listed as Port Royal Shell Point Road interconnectivity, because again, where it comes out is as much unincorporated as it is incorporated area. So we'll work on that. But council, I want the rest of council, is there anything on that list? I mean, we've got the big ones we've talked about. They're there. The Spine Road, as you can see, very much there. That was one of the ones. We've got the Reboat Road, Ladies Island Drive project is there. I'm really interested to see what $1 million is going to get us there. But I thought, Eric, when we left you last time, you had mentioned that you were looking at a Reboat Road, what I'll call Causeway to Boundary project that might be added. I don't see that. Is that still a possibility?
That's not, again, these road lists here is the information we had from November 2019.
Okay.
The list that I'm going to send you tomorrow is the updated project list. I didn't have that for tonight's presentation. I will email that out to you and all the town or I'll
send it to Van, he'll distribute it.
Van tomorrow, and he can send it out to the town so we can get your input on it. We've updated all of that with all of those things we talked about in our last meeting.
So
and in fairness to Eric and the county, we've been banding about this this project list for North of the Broad for quite some time. And, a lot of, the additional projects were results of the tool study. And I'm also meeting Friday to discuss some improvements along that corridor. And I think we're still trying to work out the details of that connectivity between Battery Creek and Rebo Road.
And I know having been a former Port Royal resident myself, I can tell you, you all are sitting right on the cusp of really blowing wide open from a growth standpoint. And if we get that situation with the Spanish Moss Trail and all of that connection done down into the port and all, that area is just going to take off. And it's, Mayor, I hate to tell you this, but you're probably going to have to add people to help Linda to keep up. So anyway, because it's just going to be unbelievable. So anyway, it's going to be a great attractive place to come. And I'm really excited about it.
It already is. It's just more people are going to learn about it. It already is.
I agree. Yeah, I agree. I agree. It's going to be even greater. It's already a great place to come, and it's going to be even greater. So anyway.
Okay. Well, we're really excited to see the other list. So,
yeah.
That's going to be the key. And I assume that list will mean that number changes that we're looking at here.
It will be, and that's what we had to go back and recalculate.
Okay.
We had to see how much the number on the fee. So what I'm getting ready to go with you all are projected numbers on the impact fee based on the project list that have with additional things that have been added. It may change, but two bullet points here at the top. We have this thing called the penny referendum. I would like to talk about that briefly because I think there's some hesitation from elected officials, and I'm talking more to town council members here about, we can't make that penny referendum too large because people won't vote for it. Well, again, I've worked in other jurisdictions where we had the penny, and our citizens always voted for it after we got the first one approved, because again, you had people that are coming in from outside the county that come here for vacation and things like that, helping do road improvements that we don't have to tax people to do. The road improvements are going to be necessary regardless of what happens. So you might as well have people that don't live here full time that are spending a lot of money while they're here, helping improve these roads that they're using while they are here. In addition, the second point is that of all of these things on the project list, the county anticipates us contributing 85% of the cost of those infrastructure improvements. So only 15% is going to come from some other source, such as state infrastructure bank or other funding that might be available to us, wherever that might be.
Okay.
Eric,
So this is a South of the Broad project
Eric,
list.
I'm sorry,
Yes.
Kevin, was that you?
yeah, I just had a question really quick. Was that list, is that indicative of priority, or is that just a random list?
That's just list. That's just,
Okay.
there's no order to it.
Okay.
I would, just looking at the list real quick, I can tell you that the Sea Island Parkway improvements is going to be one of the first things we do. Because that's just, we've got the referendum money to do that. So, 15 million of that is going to come from impact fees, and the remaining will come from the penny.
And we just need to remember, when those cars leave, they come right through Port Royal.
We are aware, and that's why.
Okay.
That's why
Sorry,
we-
Eric, you're going to hear it
That's
every
why-
time I get to say it, buddy.
That's why, Mayor, that I made sure that we listened to you, and on the updated project list, that we put your intersection improvements on Ladies Island Drive and Rebo Road high on that list, and made sure we were doing the right thing over there. So
You just know I'm going to say it when I get the opportunity.
that's good. I don't mind it at all. It's that's the way we accomplish stuff.
Yep.
So
Yes, sir.
keep having the discussion. So that's good. So again, the list in South of the Broad, I'll let you look at those real quick in case you have any questions. We won't spend a lot of time here on the project list there. in case you have any questions. So,
16 more traffic signals south of the Broad. I'll stay north as much as possible.
yeah, yes. So, so just a lot of issues going on south of the Broad, a lot of growth there.
Yeah.
The big ticket item, of course, is the bridge widening. We're going to use $200 million of the impact fee for that. So, all right, what did I just do? So the fees for the north of the Broad, again, you can see they're coming down based on the project list we had at the time. This may change a little bit. I don't think it's going to change drastically because I think we had enough stuff built in to cover the new projects and all. So this may adjust a little bit, but everything is decreasing across the board for transportation impact fees north of the Broad. And this will, so again, transportation, we're now switching into collecting impact fees based on non-residential projects, commercial, retail, office, things like that, which we currently do now anyway. So, and then south of the Broad, you can see some are decreasing, some are increasing.
Okay.
So the north of the Broad projection is that we would need $3 million of expenditures over 10 years. We're going to collect $3 million. So as of the day that we did this slide, we had enough money being collected to cover the cost of the transportation improvements. But again, because of the additional projects, we got to send that to the consultant and get them to recalculate. South of the Broad, again, we're in pretty good shape there. We would only have to find $850,000 of additional revenue to cover all the projects on that list. And then here's the total fee summary for all of them together. And you can see the impact over on the very last right-hand column. So this is Parks and Rec, Library, EMS, Transportation, Fire added. You all would have to take out the fire impact fee, and I can try to do that tomorrow and send you all a chart when I do this for that. So you would basically just, reduce this green number by that amount. So I'll give you a chance to absorb that in case you have any questions.
No, I'm glad. I'm in a lot of what I'm good with this, and I'm glad to see that the commercial is dropping because we need more commercial development.
Yeah, I agree.
We need more commercial development.
Having a transportation impact fee on commercial can be problematic. So that's, again, when I was in Berkeley County, we had a transportation impact fee and it was problematic for many developers and stuff. So we use that as an incentive for people to adopt a bigger 1 cent referendum to do more projects, because we told the citizens if they would do that, then we would repeal the transportation impact fee on non-residential projects. So they did, and we did. So there is no transportation impact fee there now.
Very good.
So housing affordability, I'm not going to spend a lot of time on this. You can basically see that we're pretty well in line with housing affordability being right there at 33% of income. Renter occupied is always higher, but with the impact fee, it could impact it a little bit. But for owner occupied, we're well below that. I think mortgage companies use 30% or 33% as the amount of money that you should be spending on housing. So, and then also let me go back and let y'all look at this is the south of the Broad numbers, a lot higher because of the school impact fee, but again, not terribly unreasonable. So, and then that's it. I answer any questions or hear any comments about it. Impact fees, obviously I'm a fan of. I think it's a great way to cover the cost of growth because the people that are causing the need for the infrastructure are paying their proportional share of the needs of putting that infrastructure in place.
Eric, could you do me a favor? Would it be difficult for you to go back to the last slide of the transportation one?
No,
Yeah, that one. So explain on the left side, the county cost, the growth cost. How is it determined? And you can go one more to north of the Broad if you want.
Yeah.
How are you making that determination? What's growth versus non-growth?
it's basically a statistical analysis that's run by the consultant.
Okay, okay.
So I don't really know. They have a methodology that they use to prove that is the amount that the growth produces a need for.
The reason I question that, and maybe we can ask the consultant at a different time, but is that, the Spine Road project alone is a 5 million, I think, on that list. And that is that's all about growth. I mean, it's a new road. It doesn't exist. It's new houses, it's new businesses, it's a whole development. And in my mind, it just seems like, was that considered properly? Is the number high enough that for growth cost in a scenario like that?
Well, we certainly hope so, but I'll certainly ask the question of the consultant and get you all an answer on that.
Yeah,
I mean,
it just, and I understand models, and I just want to make sure, the model only gives you what you put in the data, so
Right, yeah.
maybe we didn't get that data right on that Spine Road as far as what it is. I mean, it is all of the growth that's going to happen on a property right now that has zero occupancy,
right. Yeah.
retail, residential, commercial. So I just
Yeah,
want to make sure we got that number right.
Yeah, and I agree with that, and we'll make sure we do that. I'll reach out to them tomorrow on that.
Very good.
I would think it's got to do with them calculating the amount of capacity that's added to the overall system as a result of that project. So,
An explanation would be good. That's all, sir.
yeah, we'll get you one.
Very good. Council, question, please. I jumped in the beginning, and I'm sorry I did that.
I don't have any questions. That was a lot of information. Thank you, Eric.
Jerry,
And I guess we're all looking forward to that list tomorrow.
yeah. Well, again, take time to absorb it. Again, the impact fees are hard to comprehend on the first go around. The reason I'm so good at it is I've done it for years, and I've done this presentation about 7 times now. So.
Good. As we go through it, and I know you've kind of went through it a little bit tonight, if we have questions, Eric, is there a number where we can call you? Will you have that on there?
You can call me at 843-441-6129.
6129. Okay, thank you.
843-441-6129.
Okay. Eric, thank you.
Kevin, you had something?
I was, first off, like I said, thank you. When we bumped into each other the other day, I was looking forward to the presentation and told you that I was going to have some questions because I believe, like you, that it's a really powerful way to get some, capital improvements done. And, but like you said, very confusing at first. So you did a really good job of breaking that down for us. I was just going to ask, is there, to explain what the process is of when projects go onto a capital improvement list, how those are funded? Is it first in, first out? Is it each municipality gets one? Is it most expensive? Like what's the process of how the funding happens to the projects?
So that's a really good question. And it's basically just the way we prioritize them on the list. So that's going to be key to, before we adopt all of this, that we make sure all the municipalities are in agreement with the way we prioritize them and the time frames for doing the work, if that makes sense.
Gotcha.
And Eric, another question that I have is some of these projects, there's no restriction for reimbursement. So if the project is approved and the funding is there and that kind of stuff, you can borrow against and the project can reimburse as the money becomes available.
That's correct. We could let a bond. And the great thing about this is I do not believe the type of bond that you let for impact fees would count against your debt ratio, because you have a revenue source to cover it. You just don't collect all the money, at one time. So
Very good.
yeah, you can do that.
Very good.
So
Because timing obviously is important. That spine road is something that's important to us to get done as quick as possible. And if there's a way we can do a bond along with other things to get it moving and then repay that back without having to increase our debt service or deal with that aspect, that's what we want to be able to do. So
yeah, and an additional thing I'll tell council real quick, you all need to keep in mind is if a developer comes to us or comes to you and says, hey, I'm ready to do this work now because I want to do this development now. And you say, well, we're not ready. It's not on the list to be done for another 4 years. And they say, well, we'll go ahead and pay for it and do it ourselves. Then we can credit them the impact fees based on their proportional share if they do the work out of pocket. So they don't have to do the work on a list and then pay an impact fee. They would get a credit for those impact fees that they would have to otherwise pay, if that makes sense.
very good. I
the
wasn't
same with
aware
afford-
of the credit.
And the same with affordable housing as our county council has been very good about dealing with the affordable housing issues as it relates to impact fees. So we have a fund where the county council covers any impact fee waivers or reduction impact fees when a developer wants to do an affordable housing project. So
Very good.
Eric, when does our current intergovernmental contract regarding these expire, and what's the timeline on when you'd like to get these new impact fees in front of council for, like you said, to have the first reading, second reading?
well, I would hope that we would be going to council on these sometime this month
Okay.
for adoption of the readings for the updated study. So we got to move pretty quickly here in order to get a reading in January. We're not going to make January 11th, but we possibly can make the fourth Monday of January. That's why it's so critical for me to get the information out to you all tomorrow, have y'all take a look at it, make sure you're in agreement on the list so we can move on. We need to have general agreement before we start adopting this, that the project list is correct. I don't think we have to have the impact fee, the intergovernmental agreements adopted. The current intergovernmental agreement will stay in effect until the current project list is completely built out, and we are a long way from that, honestly. So we got time.
Very good.
This will be adopted well in advance of any expiration.
Okay.
And just for another point of clarification, the fee is generated by the costs associated with that list of projects. Running parallel to that is each one of these projects have to do a traffic impact analysis. And based upon that traffic impact analysis, they typically have to do on-site improvements, which are not funded via traffic impact fees or a waiver of the traffic impact fee. Those things are done in conjunction with the larger scope tied to the impact fee project list.
Yeah, that's correct. Because those types of issues that are identified in a TIA, traffic impact analysis, don't add capacity to the road. It just helps deal with that impact of that project on turn lanes or decel lanes or, and things like that. So
Perfect. Thank you.
Very good. Well, Eric, thank you very much.
oh, you're welcome. Sorry it took me so long to get through all of that.
No, we had two big subjects, but two very important subjects tonight. We needed this information so that we can start making some decisions on how we want to move forward and how it affects all of us. We look forward to more information, and we'll bother you as we need clarification on stuff.
I appreciate it. You let me know. I'm happy to do it. Take care. Good to see you all. Happy New Year to everybody. And again, it's always a pleasure to deal with one of my favorite town councils around since I used to be a resident there. So anyway.
Well, we're going to convince you to come on back. Don't you worry about it. Don't you worry about it.
Maybe one day. I will look forward to it. See y'all. Take care.
Bye-bye. See when we get our screens back. All right. How's everybody doing? Ready to just move through?
Yes. Sure. Yes.
Okay. Next item on the agenda is the council briefing.
As you'll notice, we have Tony Maglione with us this evening, who's been sitting very patiently over on my right, if you will. But I just want to let you guys know that Tony has more or less officially retired. This may be one of the last opportunities you have to interface with him in an official capacity, although I will be picking his brain from time to time. I've enjoyed working with Tony since basically I got here. And he's done a lot of great things for the town, and I'm getting ready to talk about one of them. And I may not steal his thunder on this. I might let him walk you through a little bit of it, but I wanted to make you guys aware of that.
Tony, we all are going to have things to say. I've got to work with you twice now in two different capacities, and they've both been enjoyable. And when the time comes, person knows the time's come to retire. So we wish you well. You're on mute also. I wish you well. I wish you enjoyment, and we will pick your brain if you'll answer the phone.
Well, thank you, Mayor. That's much appreciated. This is my second try at it, and so the wife said you better work this time. But it's been an absolute pleasure serving the town and watching it go over. I hate to say almost 17 years that we've been at it, but it's sure come a long ways.
Very good. All right. So what have you got for what is going to be the last thing that you're going to impress us
I
with?
think I got two actually, right?
Yeah, he's got
good.
two. He's got two. But the first one, I'll start and then let Tony kind of maybe feed you a little bit more specific details. But he and I walked the Cypress Wetlands a couple of days ago. Just kind of, he was going through the punch list with the contractor and the consultant to review a lot of the work that was done. And overall, I think most of you've seen it. It's very visible, and we're pleased. And I'll let Tony add to any of that as far as that goes.
Basically, it speaks for itself if you go out and look at it. It is an abrupt change, but a necessary change. And a lot of people have been, taken back. And what have you done? Why have you gotten rid of all the trees? Well, all the trees were invasive or invasive plants, and the canals were full of silt. And we went round and around for probably 4 or 5 years to try to get this thing done. We were fortunate to be able to fund it with stormwater fees and working with folks at Folk Land Management, who's, by the way, did the original design, got the contractor who did the original construction in 99 to come back and worked with us very closely to get it in. Believe me, we got a lot more done than we thought we would. Main reason is we were able to work out a scheme to create a third island and use that island for debris. Basically buried the debris there and put good material, as good a material as we had on top to create another island that'll be planted. So what you have now is and all the smaller wetland going over 16th Street, that drainage has been worked out. We're going to put an additional flow control structure between the little wetland and the big wetland, so we can control the water elevations better to help the aquatic weed control. The next step, and this is where it was a good transition time for me. Dean Harrigal, who works with Folk Land Management. Dean was also with DNR for many years, most of his career, doing these projects. This is what he did. So this is kind of a little brotherhood of guys we have working. I've had fun working with them. Dean will be kind of his company, Folk Land Management, is going to get with Van and work out a plan to be the managers of it. So because it's a technically difficult project to manage, because between habitat and herbicide spraying and tree removal and et-cetera, just general maintenance, they do this stuff for plantations all over this area. So it made sense for them to step in and take over the management role at this point. They will develop a tree planting schedule, list of trees. We've talked at length with the Friends of Cypress Wetlands about helping fund trees to get them planted. That'll all come probably sometime this summer. In the meantime, they'll put together a herbicide plan for spraying tallows, because we've mixed stuff up and created a lot of good organic base for things to grow in. And so the tallow trees are going to just go absolutely ape in there. So the trick is to get those things when they're 6 inches tall, not when they're 60 feet tall. All the other trees that remain are good trees that are perfect for nesting. The areas with the pink flags you see are areas that Dr. Chris Marsh came out with Dean, and they marked as basically shrubbery and black willow that needed to remain, that were good nesting areas. And they even found the large alligator in the process. So we know where his den is now. And he's a big boy, but he needs to stay in there. He just drives around that island, waits for literally shakes the trees. The little birdies fall out and he's got lunch. So he's a happy guy. So I think, with that, it's a good turning point, and everybody loves it now. Hopefully you'll stay with it and not let it get back to the state it was after it was built the first time. So I'm super pleased the way it came out. And I hope, it wasn't too evasive to do, but, wait till the birds come back. And I think you'll find you'll get a plethora of birds, much more than you would expect come probably April, May. You're already getting them at night. If you look at the videos Vance got. Yeah. So.
Yeah, just a couple other things that we're doing. Well, actually, the Friends Group has made arrangements with one of the property owners on Richmond to allow for the location of a camera, working with Hargray, that will be up and available for people to check out the wetlands just around the clock. And then the second part, which we just discussed, is I think working with Wood Brothers, we're going to create basically a camera location area for people to conveniently take photographs. So there are a couple of other features that we're adding to the wetlands also.
Some of the areas you see, like along the YMCA, has been regraded to a very shallow slope. Also by the police station, those areas will be grassed. Right now with temporary Bermuda grass, ryegrass, and then some probably coastal Bermuda, to become kind of not necessarily pretty lawn areas, but areas where folks can sit and watch, and it can be maintained with mowing, and can get it up, you get a good view without getting too close to the edge of the wetland, or areas where there may be critters they don't necessarily want to encounter.
Okay.
Very good.
And it's all been coming in just about budget. I think we're about not even 3 or 4% over budget.
And we added a couple of areas that they're helping us clean out.
Yeah.
And we did have some adventures in duck blinds today. So we're circling back to try to figure that out. I think it was a little muckier than we anticipated, and we almost lost a piece of equipment. Or we didn't, the contractor did, but they were able to take care of it.
And he's working on another plan that he and I will talk about tomorrow to kind of move the location where we're going to start digging to a little more stable area with that long reach hoe that he's got. I said, just give me a 25 by 25 by 6 foot hole for the aerator, and I'll be a happy man. So that's a work in progress. But the equipment was there. It was an ideal time to come in and have them take a shot at duck blind, because if they can't get to it, I don't know anybody who's going to be able to, short of dredging.
Yeah. He had one of the longest reach machines in South Carolina down there.
Yeah, he had 2 of them.
Yeah. Yep.
Yeah, and that's not his biggest machine. He actually has 2 amphibious rigs that are actually about 3 times the size of those long reach hoes.
Very good. Well, I've been impressed. Council, anything you want to add to this? We've had some really good press. Recently, the article that came out about it really highlighted the whole history of how it came about, why it's there, what it does. I think it was a very well written article that really helps people understand what the Cypress Wetlands is all about.
Yeah, and don't forget its stormwater function is provides as well. Stormwater, it is the largest regional BMP I think you'll find anywhere along the coast. It looks nice, but also performs a heck of a function as far as water quality.
I was just glad to see the birds back. The birds didn't stay gone for long at all.
Well,
so-
there are a lot of good bugs we dug up for them. They're happy now, man. They got a buffet.
Yeah, I bet. I was glad to see that.
Yeah,
So
yeah.
that's great. Thank you.
Well, thanks, Tony.
Okay.
Thank you so much, Tony.
And
Good job. It looks good.
Make it work this time. Last time you told me you were done, and then the next thing you know, I ran into you again. I'm back at you. So make it work this time.
No, if you call me, I'll answer the phone.
That's it.
Maybe.
Thanks, Tony. Best of luck to you. I've enjoyed working with you over the years, and good luck in your retirement.
Thank you, Jerry.
Yeah.
Look.
Hope you
Hey.
enjoy it.
Oh, I will. I'm looking forward to getting my COVID shot and going out and travel.
Do that honeydew list.
I'm always doing that.
All right,
All right.
next
Yeah.
item is, you got more to add, and other things you need to brief us on?
Oh, yeah, just checking out. I'll just run through the briefing. You have probably noticed the work we've done along the 8th Street fence line in the Madrid Pond. That's pretty much cleared out. Obviously, the oak trees we worked around, we got the fence yanked out. Worked with Gray Ghost on getting that accomplished. We will be adding an aerator to the Madrid Pond because we do occasionally get smells issues there. So aerator will help with that. So now that we've got that knocked out, we'll schedule the work to get that installed. So I think that turned out pretty well, and they've gotten a lot of compliments from adjacent residents on the work that was done there.
Looks good. Looks real good.
Yep.
Although Joe Lee was complaining a little bit about the breeze now. So next item, that property swap issue, the appraiser has been engaged and has begun work.
Very good.
I don't want to get too much detail of that. We're just still working on it. Old Fort project. I did put the draft IGA in your folders for y'all to take a look at. Not anticipating any action this month. It's something we'll take up next month. Running parallel to our taking action, the county will be working on that. And that just addresses the maintenance and ongoing landscaping work that will be done at the new Fort Frederick Park at the end of Old Fort. If any of you have been down there, you've obviously seen that the road has been resurfaced and the project looks really good. All right. CDBG, just real quick. The Royal Palm Sewer Grant is currently under environmental review. Is that correct, Tony? I believe.
Yes, and it'll take at least another month to complete.
Yeah, and then the second one is obviously the Paris Avenue improvements, and very preliminary at this point. Still working on a final scope of work with the engineer to get that one moving forward. Spanish Moss Trail. I do have a meeting later this week with the engineering firm that was contracted by the county to discuss their scope got expanded somewhat to not only address the crossing, but some additional issues throughout the corridor. So we're meeting Friday to discuss that. Beyond that, I don't have much to add on the trail discussion. Mayor, if you've got anything, feel free to add anything, but if not, I can move on. Shrimp facility. We've been working with other municipalities and entities in Beaufort County to address a list of projects that could potentially be funded with non-recurring dollars at the state level. One of the things that we've asked to be included or considered for funding is the construction of the new dock, the new shrimp dock. Alongside that, obviously, we're partnering with Gray Ghost on a joint use facility for shrimp processing and potentially retail. Y'all seen the drawings on that. You've seen that scope of work. I've asked for that to be thought about as well. I forwarded the list to Senator Campson, who is the senator for Port Royal, and he's agreed to take a look at that also. Audit, we will have a presentation next week from our auditor. I believe y'all did get a PDF or a Dropbox invitation to take a look at that. So please do. And if you have any questions, I'm sure Lisa will be happy to answer those. Baynard Grove, drove out there today. Looked pretty squared away, a little bit of dirt on the road. That's something we'll talk about. I did talk to them about trucks exiting out from Baynard to Savannah Highway rather than using the other roads. And while I was doing that, I did pass one of the dump trucks coming out. So that seems to be moving forward and everything is in compliance at this point. Traffic and road project, four-way stop was installed at Old Shell. Once Jeff coordinated with Tony on those locations, we get that done. As I mentioned earlier, Old Fort Road has been resurfaced. And just, kind of a discussion that, obviously we heard an extensive discussion on road projects with impact fees. There are other potential funding sources, which I've kind of alluded to a little bit later that maybe we can discuss. One is obviously the local option sales tax and one is the tag fee. So I think that's something we'll talk about a little bit further down. Porter's Chapel. I think once we have selected a landscape contractor, I'll work with that group to work on a scope to wrap up the landscape improvements there, as well as locating the signage. Naval Hospital sidewalk and National Park relocation. Councilman Phillips is able to arrange a face-to-face via Zoom with our Congressperson-elect Mace to discuss, our our issues with the Naval Hospital sidewalk fence relocation, as well as the National Park fence relocation. She agreed to look into those for us. I did have some contact from the DOT. We seem to have worked out a plating issue and an ownership issue for that abandoned right-of-way adjacent to Old Shell Road and the Naval Hospital fence line. And so we're preparing those documents. So hopefully that will expedite at least that portion of the fence relocation that we're dealing with. Paris Island, nothing really new to report. I think you all saw a draft of the resiliency grant study that came out. So we'll dig deeper once that's finalized. We are a participant financially in that study. Tag fee, Mayor, I don't know if you want to talk a little bit about what you're trying to do and how we may envision that going forward. That's just a little synopsis that I provided to council. So I'll let you have that one for a sec if you want.
Yeah, the current county tag fee, we've had some discussions about this in the past. The tag fee that is in place right now can only be used on county-owned roads and can be used on state highways. Cannot be used on any municipally owned roads is the way the ordinance that is in place now. It's about a $16.60 some odd cents fee that's charged to all residents in Beaufort County, whether you're in a municipality or not. I've started a conversation with the other elected mayors and the county as well. They've heard from me. Eric Greenway's heard from me, Alice, and a few others, that maybe it's time that fee be relooked at. And the county is completely different than what it was when it was put in place in the early 80s. The municipalities were very small. County had a lot of roads they needed to deal with. They had a lot of dirt roads, and that fee was put in place to deal with those issues. And at this point now, with the funding change and the increase in population in the county, as well as in the municipality, is it time for that fee to be looked at and redistributed in a way that part of that fee comes directly to the municipalities and part of that fee goes to the county to do those jurisdictional projects. So I'm going to be trying to move this along. It appears that we have, the other mayors are very interested in this process, and we're going to try to find a way to see if we can't just reopen the ordinance and get it looked at again and say, so that there's only one fee associated to the residents. Town of Hilton Head's made the decision to put their own tag fee in place. So they're being tagged twice. If you live inside the municipal limits of Hilton Head, they still have to pay the county tag fee and they pay a Hilton Head tag fee. In my mind, let's make that fee organized and let's do it once so everybody knows what it's going for. So that's what I'm trying to do. It's not going to be a quick process, as we all know, but it is something that I'll be working on, and I'll keep you apprised of how it goes. Increasing the number a little bit, maybe taking that $16 up to an even 20, 75% to the municipality. If it's within the municipality, 25% to the county. The county keeps everything in the county. So they get a little bit of an offset because it goes up $5. And the current ordinance does allow them to do an increase. It was built into it. They have never done one, but it is built into that. So it really requires them to reopen the ordinance, rewrite it a little bit, and then pass it again. So it would be what I'm proposing would be a $4 increase to the average citizen, $4.40 to the average person who registers a car, but the money would be divided up so that we could use it on any road. We could use it on a county road within a municipality, our own roads that we own, or if we want to take that money and put it towards a state project road where we want to do an intersection improvement. That funding, we do it. That's the way I would like that fee to be, not dictated to be on a single type of road only. So that's a quick summary of what I'm trying to get going and trying to get some traction for. It seems that it certainly, the brakes were not slammed and told me goodbye. So that's a good sign that maybe we can keep talking about it. The whole idea, as you've heard me say, is to start posturing ourselves to have a long-term finance plan for the assets that we own and maintain.
Sounds good.
And again, kind of moving along to the potential other source of funding for capital projects is the local option sales tax. And I just wanted to keep this on your radar. If you do engage any of your county council representation on about what that path forward looks like, and if we're still moving towards the 2021 timeline for potential adoption. So I think that was the That was the vision of everybody involved when we kicked this thing off again. And I just want to make sure that we're still on that path. Short-term rentals, this one's a little more complicated. We're still trying to resolve payment from these vendors that apparently goes to the state and then has been routed to us supposedly with no, and I've discussed this with y'all, with no way to reconcile what we've paid against any of the existing licensed units. I have one particular owner in town I truly sympathize with, trying to figure out, she claims to have paid us directly as well as paid the vendor, who then paid the state, who claims that they've then paid us, but we'd have no way to show that. So our attorney is trying to work with the contacts for each of these companies to construct some sort of arrangement so we have some sort of reconciliation. The city has worked out something, but I believe that there should be some statewide solution to this problem. And I'm hoping that that does get addressed. As I've mentioned, I've talked to the head of the Department of Revenue about this. And, for them, it's a limitation on, it's a limitation of resources to be able to figure out these units and payments. So just wanted to let you know that we're still working on it. Just kind of a unique situation moving on to garbage. In most cases, we have, have a house, you have a water and sewer bill, and you're able to handle the garbage and recycling fee. What we discovered in Azalea Square is that they have a series of buildings. These buildings are master metered. And so subsequently they were receiving one bill for garbage and recycling. We have worked out an arrangement with our provider and Azalea Square's management company that they will now work out their own arrangement for garbage and recycling so that we get out of this kind of this poor billing cycle, if you will, that was potentially going to cost us some money. And we've sent out a final bill to Azalea Square, and they are working out their own garbage and recycling arrangement. So just wanted you to be aware of that.
Very good.
And then finally, Smilex and Ron Road, this is something that we've been talking about for a few months. And I just wanted you to know that, the town is absolutely in support of the potential redevelopments in that area. The one thing, or the couple of things that we were concerned about, is ensuring egress, ingress to the property owners that are adjacent to these developments that do live in the town of Port Royal, as well as, if there's a master plan for addressing transportation and how it moves throughout this potential redevelopment, because it does also include a probable temporary route for the Spanish Moss Trail until we can resolve some of the crossing issues. So just wanted y'all to be aware of that also.
So is that developer still working with you to come up with some sort of a written agreement on what he's willing to do so that we could support the
Not recently, obviously with holidays, it's probably
Okay.
something that, took a little bit of a break, but we're hoping to revisit it.
Okay, all right, very good.
Oh, and a couple other things real
Yeah.
quick.
Oh.
One, you see the chief here, and one of the things we talked about is when he submitted the numbers that y'all received in your packet this year, they were kind of year-end numbers. I don't know if he's prepared to talk about some of the trends that he's seen, some of the things that how they're reacting, maybe talk a little bit about what's going on with traffic. But since I've got him captive here on the Zoom and it's something we want to talk about, I want to turn it over to the chief for a little bit.
Great.
Absolutely. Let's talk about traffic for a minute. Last year we had 333 traffic accidents, and this year we're down to 203. And I would take that as our efforts for traffic enforcement, because we're up from 1,600 traffic citations last year to 2,207 this year. So it's definitely been an enforcement effort for us. And thanks for the new traffic safety grant, I believe. The only other trending crimes, we've had a slight influx on assaults. 157 last year and 194 this year. And that's going to come and go with population. We've had a number of shootings. We had 30 shots fired call in 2019 and almost the same in 2020 with very few arrests, because by the time we get it reported, and they're almost always in a vehicle, it's just hard for us to catch. And that's the only big things that stand out.
And Chief, one of the things I noted, I think y'all are trying to be a little bit more active with one of our problematic apartment complexes. I noted in some of the daily reports that you've talked a little bit more about community policing. I don't know if you want to talk about that a little bit.
We've stepped up efforts in those. It's actually 3 target areas on Southside Boulevard. And with help from the county's violent crime task force in Beaufort City, I think we're trying to get a little bit, a lot of it under control. And there's a private security company that's moved into the old August on Southside.
Very good.
Y'all have any questions for the chief?
Chief, one of the numbers that I saw that jumped out on me was civil disturbances. And what is that? I mean, how do you classify that one phrase right there? It's 15C on the report, I guess is
That's basically all others.
okay.
So that's your minor issues that doesn't fall in national crime reporting stat.
Okay, because I saw that number went up a decent amount in the year, and I was just wondering what that was. The traffic numbers that you pointed out are very interesting because we all know there was a portion of time where everybody was staying home and the cars were less on the road. We had that issue as well, but it's nice to see that the traffic enforcement number has reduced the traffic accidents. And
Absolutely.
people say you're just writing tickets. Everybody thinks a municipality writes tickets for money. We get very little of that money. That is not why we write tickets. That's the reason why we do this, and that's the reason we're doing enforcement, is to protect the citizens and protect the people riding on the road. And we've got that correlation, and I think it's great that you've highlighted that. I appreciate it.
Absolutely. And I did a report for Mr. Willis quite a few years ago about us writing traffic tickets and ended up in court and overtime. And we're actually probably, I think back then we were $17 in the red per ticket.
Wow. Maybe it's a time to update that report and do it again.
I can do that for you. Yes, sir.
Just so that everybody understands. I mean, I think it's important that the citizens know that it's not about making money. That's not why we do that. It's about safety and it's about protecting people.
Absolutely.
Council, have any questions for Chief? It's always good to hear from him.
Thank you.
Do you like our new stop signs on Old Trail?
I do.
I found them very good, and it wasn't a surprise when I drove by. Mary Beth, you probably go more than any of us through there. Have you noticed it helping?
Well, I watched a truck that had a big name on the side go right through it the other morning, and I thought, you didn't even look. But I mean, I think it's good. I really appreciate it. I still have the habit of stopping and looking, and Billy will say, would you quit looking? You got stop signs on either side. I said, yeah, but they might not realize that stop sign.
Great. I don't trust other people to stop. I need to make sure
That's
they're
exactly.
absolutely right.
Yeah.
That's good. Well, thanks, Chief.
Yes, sir. Thank you, guys. Happy New Year.
And I did want to ask Linda to give you guys a little bit of an update on where the comp plan is. And I think she has some information she wanted to share with y'all about some concerns with the surveying.
Yes, thank you, Van. Good evening, Council. We do have the technical steering committee, the advisory committee that we stood up to help with this met today. And we have a draft copy. It is not a complete copy yet. There is still some placeholder pages in there, but you can definitely see where it's heading. And we heard many compliments from the group about the appearance of the document, It's very nice. But the feedback that I did receive was that we're concerned as a committee that we didn't get enough response to the survey to validate the information and the conclusions that may be drawn from what we got. And so we're going to approach the consultant and let him know that we would like to open the survey back up. So that will be on the consultant's end to stand that back up, and then it's digital, so it really shouldn't be very much. It's just a matter of reactivating the survey on the website. But what we as the technical advisory committee saw as our duty was to drum up interest in trying to take that survey. And so we came up with a couple of ideas. And one of the ideas I think has merit, and I've already run it past Van, and that is to send out a mailer to every household in the town of Port Royal, letting them know where it's at, and please inviting them to please look at the survey and respond to it. You know that we have a town that is stretched out in a number of corners of Beaufort County, and that perhaps we have folks that don't even realize that they are covered by the town of Port Royal, and we want to let them know that. I think this is doable. We've done it in the past. It's been a number of years. In this digital age, we kind of don't think this way, but because we've used all the digital means of announcing the Facebook announcements, the newsletter, the digital newsletter, etc. So that is what I went to Van to talk about today, and I think we're looking at a way to do that, to accomplish that. Might enlist the aid of Beaufort Jasper Water and Sewer because they've got a database, they've got a label for everyone that's in the town. Beyond that, that's what we're hoping to accomplish. That's what the next thing is we want to do. We want to take our time. We want to do it right. I think that we were all in agreement. We've been given time by the state to accomplish this because of COVID. There is an extra amount of time given to the communities that are in the midst of writing their comprehensive plans so that they can carry on business as usual until we get this document produced and adopted. Anybody have any questions about all that?
Council?
I have none.
No, I think it's great that you're I've heard that same concern from citizens as well about the comp plan. So I think it's great you're looking into ways to resolve that.
Yeah, and the only thing I would add, if we do decide to do a mailer, either somewhere in the comp plan survey or in the mailer, let everybody know that there's a way to sign up for the Port Royal newsletter. Please,
Yes,
just
good idea.
use that at the same time to increase our digital footprint in the future, get more email addresses, get more people signing up for that newsletter. It's just another way to do that as well. I think if we're going to spend the money to do the mailer, let's get that other piece in there. That's the only
Good
thing.
idea.
We appreciate thank the technical team for being so, concerned about it and rethinking about it and going back at it in a different way. I think it's great.
Absolutely. I would commend them. They're very much engaged. It's a good team, and staff definitely appreciates the diligence that group of folks have given us to help us with this.
Good. Anything else, Van?
Well, I've got the fire chief, the assistant city manager, and interim city manager down there at the bottom. So I feel remiss if I didn't let him say a few things if he needed to.
No, thank you, sir. Everything's been going very well for the fire department. They have been rather busy throughout the holidays. And I did report to another meeting the other day that the fire department finalized its numbers, run call volume wise anyways, for 2020 was 4,138. It's about 134 more than last year, and about 1,000 more than before you opened Station 4. So they've been busy. You can back that into about 1,000 calls per station for the year. But things are going very well. Training is progressing and service is being provided. And, on behalf of the men and women of the department, Happy New Year. And we are excited for 2021. And I know that you all are concerned about Bill Prokop and probably read about him in the newspaper. I'm happy to report that he is home and doing well and well on his road to recovery.
Thanks, Chief. Chief, maybe next month you can consider doing something similar to what the police did and see if there's any trends in those numbers that are concerning or anything you want to highlight to us. And then last, if you could think about that EMS impact fee from your perspective and how we respond to calls inside our municipality, and help us understand how that's going to benefit the citizens on a whole and everything with that impact fee. Because I think you have the best understanding of how that would all work and what would happen once we see the project list.
Yes, sir. Absolutely. On the first question, our annual report will be done shortly. It's being compiled and finalized as we speak, and it'll be published through your work session next month, I anticipate.
Great.
And the second one, we will do that. Yes, sir.
That's great. Anybody else got a question for Chief? We got them both here tonight. We're happy.
One comment for Chief. I just want to say, I know things are a little different this year with our Christmas festivities, but I appreciate your folks at the fire department stepping up and spreading Christmas cheer throughout the area. Thank you.
Thank you. And that was when I found the stop sign on Old Shell Road too. No. Thank you, Councilman Ashmore. And I'm sure that Santa Claus really enjoyed the time. And we were able to get to most parts of both communities, Beaufort and Port Royal, and it was well received. And thank you for kicking that off after your tree lighting. The folks that participated in that really enjoyed it.
Yeah, Jerry, maybe you'll make it next year.
You're right.
Yeah.
We got to work with his schedule next time. Make sure he's in town.
Yep. I just want to say thank you to all of Town of Port Royal's employees. What a great year we had last year and all the challenges that we met. Every one of you should be commended for the jobs and your people and what all you did for our town. And so I personally would like to say thank you. Thanks is probably not even enough because I know day in and day out they face all of these COVID calls and we never know from day to day. And so thank you from the bottom of my heart to all of your crews for what they do. Jeff, Linda, your crew at the downtown, and just thank you.
Thank you.
Very good. The next item is a review of the agenda for next week. If everybody's had an opportunity to look at that, is there any questions or concerns about the agenda?
I think while we have Tony here, if you wanted him to talk about landscape contract, I think he provided y'all with a memo and a bid tabulation. I don't know if you wanted to let him go over that a little bit.
Yeah, I would appreciate that. Is Tony still on or no?
Yeah, I'm right next to you, Mayor.
Oh, there he is. Sorry.
They didn't kick me out yet.
Somehow I just didn't. You moved on me. I was looking for where you were before. You weren't there. Yeah, the bid tabs and everything were in everybody's packet. If you want to go ahead and review them.
Yeah, look quickly. We put this RFP out probably 4 times over the last 6 or 7 years with a very detailed list of 32 different separate areas for town landscape maintenance, and it's gone to a couple companies. Currently, it's held by Southern Palmetto Landscaping. In the past, we've always had a pretty big spread in cost between the same 3 guys, no matter how many folks we call up. And I want to thank Brooke on this one because she's been very helpful to me. She called and sent emails, and I find somebody. I just said, can you get out there and find somebody else to get more activity on this? And we got got the same three folks who proposed, and that doesn't surprise me. But what did surprise me is that in the past we've had 10, 15, 20% deviation in cost between number one and number two, and last year it was almost 100% deviation between number one and number two. Number one and number two. This year it came in very tight. As you look at the three numbers that are in my memo, from Martin Landscaping, Southern Palmetto, and the Greenery. There's a one between number one and number two. There's a little over a 1% difference in cost. And then even the Martin, who's always come in high, came way down as well. We didn't change anything. We actually added to the contract. We added one additional item to make 33 areas, and that would be maintenance of the future boat ramp and parking areas at Old Fort Road. So the contract grew a little bit. Otherwise, it's the same identical scope of work that's been out there for a number of years we've been building on. So compared to last year's numbers, this year's numbers, I'm looking at last year's numbers. Southern Palmetto was 173,000. This time they were 196,000. Greenery was 236,000, and they were 199,000 this time. And then Martin Landscaping was 333,000 last year, and this year they were 239,000. So I'm not sure what's happened in the pricing of the landscaping business, but it's actually worked out to the town's benefit. So it gets down to there were in the RFP we put out, which is pretty detailed, it's over 100 pages. We very specifically say in the contract documents that the evaluation is made by council on four key points: references, experience, local experience. And, we've had all these guys work for us before in one form or fashion. Quality and performance of similar work, or in this case, existing work, and quoted cost of services. So usually it's always been a cost-driven number. Last year was a cost-driven number because there's no way you could justify the difference between $236,000 and $172,000. So we said, okay, well, we're going to switch, and we're going to go ahead and recommend a one-year contract, which council did give to Southern Palmetto Landscape. A little different this year because the cost factor really does not become a major evaluation point. I don't believe. I believe the past performance or current performance in our case of our contractors, in my opinion, and Bud will probably not like me saying this, but is subpar of what we've been getting before. We've had a lot of difficulty, a lot of change of personnel. I don't feel the manpower placed on the job is sufficient to do the workload. I think the presentation of annuals down Paris Avenue is a perfect example of the difference. And how many times that had to be redone, and it still never had got there. And that's always been such a nice, one of the things I use when I drive into town is kind of get a gauge of how the work's going. The other is coming across the Bell Bridge and coming down Revo. I look at that curve and the causeway and for trash and grass growth and all that. And so Van and I over the year have been talking quite a lot to Southern Palmetto. And now I'll jump over to the Greenery side. They had the contract for almost 5 years on and off. And at times the work was questionable as far as what we got or what things are getting done on time. But compared to what we had in the last year, not the continuous poor performance, and definitely not one change in personnel, which I think hurt a little bit, but that can be, I think, worked out as part of any contract. So it was a little tough for me just to come back and make a recommendation to y'all because of the tightness on the pricing. I think from the tone of my memo, you can see, I think we step back and we try with the Greenery. You can do it again for another year contract. Because when I look at the performance between the two, I think Southern Palmetto is weaker, and they're just not. I think they're just not quite set up for something this big. So, in a nutshell, that's what we did. let you do, no, we normally do, we put it in the paper, we advertised it. The only thing we did not do, we did not have a pre-proposal meeting like we normally have because of COVID. But otherwise, there's plenty of time. So if you do make this change, we'd probably make it effective February 1st, Dan, I would think, and then just prorate out to last year, and then make it a 12-month contract that would expire in February of 2022. So any questions on it or any of the stuff? I didn't dare give you the proposal because it would take you about 3 days to read it. But it's the same one we've used before. So any questions I can answer or input I can provide, so y'all can discuss how you might want to contract this work, because we do need to get things cleaned up.
Council have any questions for Tony with his analysis? The analysis document he sends is it's very detailed, so it's great to have that to help us make the decision. And this will be coming before us obviously next week. It's why it's on our agenda to make a recommendation. So you got any questions? We got him in front of us. Last time they say he's going to be in front of us. Hearing none, Tony, thank you for the diligence on this and tracking it so closely over the years. You're right, Paris Avenue is one of those ways it's easy to tell, and those other ways. So we'll definitely be reading your recommendation carefully and making that decision next week.
Great. Well, if you have any questions in the meantime, Vance can still find me.
Very good. Council, again, any questions about the agenda? There was one item I think we need to talk about. We got appointments. We've got we had decided to put out the Economic Development Board to see if we could get some citizen activity. We did get one, and same thing with the Municipal Election Committee. We have one. The question is, do we want to move forward with just having one and do some interviews next week, right before our council meeting or at the council meeting? Or do you want to try to solicit and try to find somebody else to compare? It's really council's decision.
Is there an urgency? We just got through an election. I think we can probably hold off for another session and see if we can get some more interest.
Van, can you talk on the urgency issue, or Linda?
Well, as far as the election issue goes, I think I agree with Darrell. You probably do have a little bit of time.
Okay.
But if you have somebody who's willing, you may want, particularly for the election commission, you may want to take them up on their willingness to participate.
Okay.
The second one is the Economic Development Board.
Uh-huh.
Like I've mentioned previously, I am serving in that capacity now for the town. As I've mentioned previously, I am the only unelected member that for the governmental entities. There are some at-large civilian representatives on that board. So ultimately, council will need to decide whether you want to choose amongst yourselves or from the applicant. We have one applicant now who's very well qualified. It's got a wealth of knowledge and background that would probably lend itself to this position.
Mm-hmm.
So that's just a decision you got to make. I don't think there's any extreme urgency on that one, but just something to think about. Because I think you're going to have to make a reappointment pretty soon with that one. Otherwise, I can keep serving in that capacity until you make a decision.
How do we go about advertising for those vacancies? Because I want to ensure that the populace of our constituents get the information. And if we're only using one source, that's Facebook, everyone's not on Facebook. That's the only reason why I made that comment earlier. But I do agree, if we have someone that is volunteering, that's commendable. And certainly by no means, I don't want to discourage them also, but I want to also ensure that we're getting these vacancies out to the consensus of the people so that, they can have, they're properly vetted.
Yeah.
We put it out across, all of the platforms. And I think, it's funny, when Linda and I were talking about the comp plan issue today, I wanted to get a confirmation on what the number of subscriptions were to the newsletter. And right now it's 800 strong. So that's a good one. How many of those are citizens? They could be from some out of towners, but that's always a good way to get word out also.
And this was in the newsletter. I had read it. It was posted in the newsletter and I had read it in there. So,
It's been in there multiple times.
yeah, I think we have two good applicants. I didn't want to just move this along in the agenda if we felt like we wanted to wait.
And I have no problem moving it along because I do, I don't want folks to get discouraged. And, we put it out for another month. And then, of course, then they lose interest and we have no one again. And we're back to ground zero.
So then in that process, we'll ask them to come in next week and just introduce themselves, why they are interested in this and how they want to help us. And then we'll take a vote after that point. Does that make sense to everybody?
I'm good.
Good? Okay. So we'll keep it on the agenda. Jerry, did you have something?
No, that's fine.
Okay, so we'll keep it on the agenda and please notify them that we're going to ask them to join on Zoom next week and kind of give us a little background about themselves and why they're interested in serving on these two committees. Okay? Anything else relative to the agenda? If not, then we can adjourn. I know it was a long meeting tonight. We had some really big subjects. We can always consider, we start at 6:30 if we think we need to move this up a little bit. It's really our decision on that aspect. But as we all know, these were important subjects that we really needed to get moving. And I think we learned a lot tonight and we've got a lot of information we can take forward. Anybody have anything for the good of the town?
No, sir.
Hearing that, we'll adjourn. Thank you, everybody.
Amen. Thank
Good
you.
night.
Night.